Cryptosporidium is a parasite that causes gastrointestinal illness, known as cryptosporidiosis, in humans and some animals. Cryptosporidium, often referred to as crypto, is found in the stool of infected individuals and becomes problematic when infected feces enters the drinking water supply or recreational water, such as pools. The life cycle of Cryptosporidium begins when the thick-walled oocyst exits the infected person in the fecal material and is released into the water, which causes contamination in the pool. Once the oocysts are ingested by other swimmers, they embed into the GI tracts of the host. Contamination occurs when people infected with crypto swim in a pool, animal feces enters through water runoff, and when drinking water is not adequately filtered. The peak onset of illness occurs during the summer months, coinciding with increased summer recreational water use. A major issue with Cryptosporidium is that it's resistant to the most commonly used pool disinfectant, chlorine. The first signs and symptoms of Cryptosporidium infection usually appear within a week after infection, and most often include watery diarrhea, dehydration, and stomach cramps or pain. The only way to know if you have crypto is to be tested via stool sample. One of the most commonly used test methods is the enzyme immunoassay, which makes use of a diagnostic kit. It is relatively easy to perform, has high sensitivity to detect low parasite numbers, and provides results in about 10 minutes. The EIA method is particularly useful as a screening tool for an outbreak investigation. The case study presented is to characterize a potential outbreak of Cryptosporidium in a small rural neighborhood in Texas using the CDC's 10 steps of an outbreak investigation. The number of cases of diarrheal disease has increased in this neighborhood within the last 3 months, as reported by physicians at a local hospital. It is suspected that Cryptosporidium is the causative agent, as many of the residents recently spent their summer days at the community pool. The county and state health departments work together to implement an outbreak investigation. The first step includes forming the investigative team, which includes a physician, an epidemiologist, an environmental health specialist, a medical technologist, data collectors, and public affairs personnel from the county and the Texas Department of State Health Services, or DSHS. Second, the existence of an outbreak is established by the unusually large number of gastrointestinal illness, which is a sign of concern for physicians at the local hospital. The physicians notify the county health department, who determines the number of diarrhea cases is higher than expected. Third, the county and state health departments verify the diagnoses by collecting stool specimens from all possible cases. The medical technologists test the stool specimens using EIA methods and finds Cryptosporidium to be the causative agent in all residents in question. They are now classified as confirmed cases. Fourth, the team constructs a case definition after verifying the diagnosis and identifying common characteristics among the infected persons. That is, residents from the neighborhood suffering from abdominal pain and diarrhea who use the community pool during the summer months are infected with Cryptosporidium. Fifth, passive and active surveillance are utilized to determine that each confirmed case is a resident of the neighborhood. Passive surveillance is completed by using infectious disease surveillance forms that are submitted to the CDC. The investigating team is also actively surveying crypto by sending letters to other residents within the neighborhood and visiting local healthcare facilities to find reports of similar cases that may have been missed. After both active and passive surveillance, the team gives a more accurate estimate of the number of confirmed cases. In the sixth step, DSHS and the local health department use descriptive epidemiology, including person, place, and time, to develop a hypothesis by considering what is known about Cryptosporidium. As summer has just ended and many neighbors who developed diarrhea spent time at the community pool, the hypothesis is that Cryptosporidium is suspected as being an infectious agent, and the community pool is a possible mode of transmission. Within this step, a case control study is implemented, and an odds ratio is used to measure the association. The odds ratio compares the odds of exposure to a contaminated pool in those who tested positive for crypto versus the odds of contaminated pool exposure in those who tested negative for crypto. Another helpful measure is the epidemiologic curve. This basic investigative tool provides clues to the investigative team about the pattern of spread within the rural community. The figure seen here illustrates an epidemiologic curve in a 2008 cryptosporidiosis outbreak in Tarrant County, Texas. The curve demonstrates the 3 peaks of exposure, all of which occurred on weekends. The onset of symptoms then peaked 5 to 10 days after each exposure peak. The 7th CDC step includes evaluating the hypothesis that the community pool is the source of disease and implementing an environmental health investigation. The investigation, in which about 120 liters of water is collected and tested, allows for finding evidence of Cryptosporidium contamination in the pool. The 8th step includes implementation of control measures by first notifying the residents of a confirmed Cryptosporidium outbreak. The epidemiologist on the team suggests closing the pool until the water is properly treated and tested safe for recreational use, and suggests that all ill neighbors remain out of the pool until the area is tested free of the disease. Maintaining surveillance is achieved when physicians report any diarrheal cases to DSHS and the CDC to monitor the outbreak. Additionally, the investigative team is responsible for completing CDC Form 5212, Waterborne Disease Transmission, and bi-monthly follow-up inspections of the pool are scheduled for the subsequent 3 months. The final step in the CDC's outbreak approach is to communicate findings to local authorities and the media. A report is written detailing the steps performed, the results, and the control measures implemented, and it is shared with the neighbors in the community, the pool maintenance company, the local hospital, and the CDC. In addition, the local TV stations in rural city Texas inform the general public of the Cryptosporidium outbreak. Now we move on to recommendations. Public health officials should consider issuing the following recommendations to several groups. First, to the general public. Do not swim while experiencing any diarrheal illness and for 2 weeks after diarrhea resolves. Practice proper hygiene, including hand washing after using the restroom or changing diapers, and showering before entering recreational water. To healthcare providers, report cases of cryptosporidiosis to the local health department. Collect stool samples and request Cryptosporidium testing when indicated. Remind patients to refrain from swimming while ill with diarrhea, including the 2 weeks after cessation of diarrhea. And lastly, to pool operators, indicate hyperchlorination protocols for Cryptosporidium which are available from the CDC website. Place diarrhea exclusion messages at pools with alerts about any outbreaks. Prohibit pool staff with diarrhea from entering the pool. And consider suspending swim classes and other group events as indicated.